Getting into chapter 8 now, our venipuncture procedures. We'll practice this a lot when you come for Skills Week. This is just a general overview of the process or the procedure of venipuncture. So we'll go through each of these steps individually, okay, and we'll talk more about what a session test requests look like. So what you want to do is enter the room, introduce yourself, okay? And some of these are a little bit out of order, so we'll kind of talk about the practicality of the order, and we'll talk about kind of generally how it works when you're in the hospital setting and you're actually performing the procedure, because it is a little bit different than how it's listed here, okay? So make sure that you, when you're doing your blood collection, okay, you're reviewing your test request and pulling up all the information that you need for whatever test you're taking, and making sure that there aren't any special considerations for the test that you're taking, and we'll talk a little bit more about those later. Observe any special handling instructions, and an example of this would be protected from light, transport on ice, collect without a tourniquet, so on and so forth. Once you know what test you're taking and what special instructions you have for each test, you can then approach, introduce yourself, identify and prepare the patient, and that just looks like hello or good morning. My name is Samantha. I'm here from the lab. I need to take a blood sample. Is that okay? Get consent, answer any questions that they might have for you regarding the tests, and then communicate with them, prepare them, just let them know I'm going to gather my equipment, or I'm going to tie the tourniquet on you and find a vein. Do you have an arm that you prefer? Ask them clarification questions. Are you allergic to alcohol? Are you allergic to latex? Are you allergic to tape? Okay, so on and so forth. Verify any testing restrictions or requirements. Does the patient need to be fasting? Does the patient need to have been resting, right? They can't just have gotten back from physical therapy, stuff like that. Sanitize your hands and put on gloves. Now, this is kind of one of those differences that we'll talk about in the hospital setting. Generally, as you enter the patient's room, you'll hand sanitize, and then the very first thing that you will do is put on gloves before you do any of the other steps. But for the purpose of the overview, it's in kind of step 4. Position your patient and apply the tourniquet. Select the vein that you would like to use. So we're applying the tourniquet, we're searching the arms, okay, to see what vein we want to use. Once we find the vein that we like, we're going to release the tourniquet. Then we're going to gather and prepare our equipment. Once we have all of our equipment gathered and prepared, which means gathered, taken out of the packages, put together and prepared to use, set next to us so that we can reach it. Once we have everything in place to perform the venipuncture, we will reapply the tourniquet. Then we will clean and let the site air dry. As the site is air drying, we're going to uncap and inspect our needle. As soon as we've done that, we're going to anchor the vein and insert the needle. Once the needle is inserted, we're going to establish blood flow, fill, remove, and mix tubes in the order of draw, and release the tourniquet as soon as we're done collecting our samples. As we remove the needle, step 12, we're going to place gauze, remove the needle, activate the safety feature on the needle, and apply pressure to the patient's arm. In this step, you can ask the patient to take over pressure. So if I had a venipuncture and someone placed a gauze, they would say, okay, can you hold this for a moment? You can ask your patient to do that. They can hold pressure while you clean up your trash, take away your caps, label your samples. Okay, after you've applied pressure or had the patient take over pressure, you're going to discard your collection equipment. Put your sharps in the sharp container, throw away all your trash, discard all of your caps. Label the tubes in the room in front of the patient. This is very important. We need to do this so that we don't make any labeling mistakes. All of the tubes that you've taken from this patient need to be labeled in that room so that the next room you go to, you already have the tubes from the previous patient labeled and there's no chance of accidentally labeling them incorrectly. After you've labeled the tubes and set them in your tray or in the bag that you're going to transport them in, the biohazard bag, wherever you're going to put them. After you have labeled them, You'll go back to the patient. You will check their arm. They've been holding pressure, remember, this whole time. Sorry about that. They've been holding pressure this whole time. So you'll go back to the patient. You'll take a peek at the venipuncture site. Make sure that it isn't bleeding profusely. As long as it's not bleeding or it's mostly stopped bleeding, you can put the tape over it. Okay, check the patient's arm for bleeding and apply the bandage, whether that be tape or Coban. Dispose of all contaminated materials, and this is just a double check. You should have already done this, but just make sure that you haven't left any trash or caps in the patient's bed or on their, tables, on the chair that they are sitting in, whatever. Okay, make sure you dispose of all of your materials. Thank the patient. Remove your gloves, sanitize your hands, and transport the specimen to the lab. Okay, so that's just a general overview of the procedure, which you'll get practice in. Step 1, reviewing and accession your test requests. There are different types of test requests. Most of the time they're electronic, but we do sometimes see manual or paper requisitions, computer requisitions, and barcode requisitions. The phlebotomist must check to see that all required info is present and complete, verify tests to be collected and the time and date of collection. Sometimes doctors and nurses will put in multiple tests across multiple days. So just make sure that you're paying attention that the test that you are taking is for today and now. Okay, so check the date and time and make sure that it's the correct date and time for the test to be collected. Accession or record the order received. Identify diet restrictions or other special circumstances. If a patient needs to be fasting, which means nothing to eat or drink, including coffee, no cigarettes, stuff like that. If it's a fasting test, I always just ask the patient, when's the last time you had anything to eat or drink? Okay. Sometimes patients know that they're supposed to be fasting. Sometimes patients don't. If they had orange juice or a coffee or a cigarette on the way in, or, if they're an inpatient, if they had a coffee, then generally you'll let the nurse know. So in inpatient, you would let the nurse know, I'm sorry, I can't take the test. It's a fasting test and they had orange juice this morning. Generally what they'll do is postpone it till the following day. In outpatient, which is where the patient comes just for the blood draw and then they're able to go home. If they smoked a cigarette on the way in or if they haven't fasted, right, so they had coffee or anything to drink or eat on the way, then you'll just reschedule them for another day. Observe any special handling instructions, no tourniquet, transport on ice, protect from light, etc., etc. If you have these special instructions, just make sure you're prepared. If you need an ice pack, get an ice pack. If you need a heat pack, get a heat pack. Excuse me. If you need to protect it from light, make sure you have your foil or your amber tube ready, okay? This is an example of what a paper requisition looks like. Requisitions must include the following information every time. The patient's first and last name. This is very important. These are our identifying factors. This is how we identify the patient always. First, last name, date of birth, their sex, the tests that are required, the date ordered, the physician's signature, and diagnosis codes. Diagnosis codes have to be on there. That tells us what test we're taking, okay, and what's the reason for it. On something like this, all of the information would be at the top, like the patient information and the doctor information and the signature, the date that they want it, okay, if it's stat or not, any comments. These are all the diagnosis codes here on the side. They're a little blurry. But then the doctor would put little check marks in the boxes that detail what test they want. That's connected to the diagnosis code that it is, which tells us what they're testing for. This is a computer-generated requisition form. Okay, so this is a computer-generated barcode. This is what you will see the most often. Look for the patient MRN, which is medical record number, the patient name, accession number, tube size, tube color, the test ordered, patient location, patient age and gender, the date and time, time collected, collected by, which is the phlebotomist's initials, and the lab that it's going to. All right, so as we look up at the top, okay, you will see the patient MRN number, which is at the very top where the zeros are. the patient name, which in this case is Doe, John, the accession number, which is here, accession number, the tube size, here, 10 mil, and then you have another tube, so two tubes, one 10 mil and one 5 mil. The tube color, lavender, and in this case it would be the Corvac tube, so looking here, the tube size and the color. The test ordered, okay, is going to be right here where it says K. And then the patient location is up in the top right-hand corner where it says 0254-01. That's the patient room number. The patient age and gender is right underneath of that, 55 male. The patient, then it's date. So then it's date, which is going to be here, 26 September 15, time 12:52. The time collected, that's an open blank space for the phlebotomist to fill out manually, and then the initials of the phlebotomist. And then down here, kind of on the bottom, you can see the chemistry, where it says chemistry and hematology. So in real life, if you were looking at this, it'd be in the form of a sticker or a label, right? So there would be a line here and a line here to separate this top barcode section with these lower two barcode sections, which would be separate from each other. So a line here and a line here. So this goes on one tube, this goes on another tube, and then it tells you which labs they go to, either hematology or chemistry. Hopefully that helps. We'll go over this more too as we practice blood drawing during Skills Week. Step 2, approach. Introduce yourself, identify, and prepare the patient. As you approach the patient, make sure that you're organized and prepared. Look for signs containing patient info, including arm restrictions. Now this is a limb alert band. Sometimes it'll just say restricted on it. Sometimes it'll say limb alert. Usually they're bright pink. This is something that if and when you get into the hospital setting, this is something I want you to be looking for every room you enter, okay? Because if you poke a limb that's restricted, it just gets you into trouble. So look for signs containing patient info, knock lightly on the door, identify yourself, and obtain consent for procedure. Hi, my name is Samantha. I'm here from the lab. I need to take a blood sample. Is that okay? Okay. Patient identification. Okay, it's very important. That's why it's listed like this. It's very, very important that we identify the patient correctly. Misidentifying patients or mislabeling specimens can cause catastrophic errors in the lab, not to mention it could possibly cost a patient their life. All healthcare workers must always be diligent with patient identification. Do not get lazy. Verify name and date of birth. This is happening with every patient, every single patient. First, last name, date of birth, every time. The patient must be actively involved in this, which means they are calling in response to you. Okay? You ask them, what's your first and last name and date of birth? They tell you, you verify it based on what you see. Great. Double check. Then you scan or check their ID bracelet. All patients will be wearing an ID band. You can scan it, okay, with your mobile device, and it will pull up their patient chart. Verify that everything matches. First, last name, date of birth, their MRN, make sure that matches. Notify the nurse of any ID discrepancies. If you see anything that's out of place or that is incorrect, make sure you tell the nurse so they can change the ID band or fix the issue. If a patient doesn't have an ID band on their wrist, okay, you need to let the nurse know. And this is in the hospital setting, of course, but you have to let the nurse know. If they don't have an ID band on in an inpatient setting, you are not allowed to draw blood from them. You cannot obtain blood from an inpatient if they are not wearing their ID band. Sometimes you'll see the ID band sitting on the counter by like the computer. That doesn't matter. If it's in the room, that's great, but it needs to be on the patient, okay? If it's not on the patient, you gotta let the nurse know, hey, this patient doesn't have an ID band on their wrist. I can't take the blood until they have an ID band. You'll go do other blood draws and have the nurse let you know when that ID band is on the patient. You can come back and take their blood then. We are waking patients up okay? And a lot of times, depending on the hours you work, based on where you go, you'll be waking patients up either in the middle of the night or early in the morning. Excuse me. You'll be waking patients up in the middle of the night or early in the morning. And so just be aware of how you're doing this, right? Don't walk into the room and flip on all the lights and make a bunch of noise. Come in nice and quietly, not quietly, wake them up gently, apologize for waking them up, and then obtain consent, and then identify the patient. Proper identification and informed consent cannot occur if a patient is asleep, and so we need to do our best to wake every single patient up. If the patient is sedated, unconscious for any reason, stuff like that, those are special circumstances where you could ask a nurse or a relative or someone, like if they have a sitter in the room, to verify the patient if they're unconscious, young, or mentally incompetent. A translator for non-English speaking patients might be an option. I know that in the hospitals they do have the translation screens that you can use, but we just want to make sure that we get correct identification on each and every patient. Prepare the patient. After you identify them, you are preparing them by explaining the procedure, addressing any patient inquiries, handling patient objections. This is kind of an important one because every patient has the right to refuse. If they refuse you, that's okay. All right, every patient has that right. Inform the nurse of the refusal. Address difficult patients. If a patient is being difficult, you can say, okay, I'm going to let the nurse know that we're not going to take the blood today. Generally, that will get patients to say, okay, fine, just do it. But if they're adamant that they don't want their blood drawn, just let the nurse know, and the nurse can let you know when they want you to come back. Make sure you are safe. Ask for help from nursing staff if you need it. This is important, okay? Scene safety is important in all aspects of healthcare. You need to make sure that you are safe. So do not position yourself or let the patient position themselves in between you and the door. If a patient starts to get aggressive, you can leave the room. You don't have to stay in there and get the blood draw. You can let the nurse know. Ask for help if the patient is threatening to you. If you don't feel comfortable with that draw, ask a coworker if they would rather do it, right? So there are steps that you can take if a patient is being difficult. Okay, just protect yourself and make sure that you are safe also. Verify your testing restrictions and requirements. Questions you might need to ask or restrictions patients may need to follow for testing may be fasting. When was the last time you ate or drank anything? Consumption of a glucose beverage for glucose testing. When was the glucola finished? Last time and dosage of certain medications. How long has it been since the medication administration ended? Some tests we're not allowed to take if a medication is running into an IV. We have to wait for it to be finished. Withholding from certain activities. Did the patient just complete physical therapy or a respiratory treatment? Generally, after these things, we need to wait 30 minutes to an hour. And then, are you allergic to tape, alcohol swab, latex, so on and so forth? Clarification questions, just to make sure that everything is going to go smoothly and that you're taking the test correctly. We are then sanitizing our hands and putting on gloves if we haven't done this already. If we're touching the patient at all, we should already have done this. But if we haven't, this is the last chance to do it before we start getting into the actual process of starting the venipuncture. So sanitize our hands and put on gloves. When is it not okay just to sanitize? Which means making sure that we're washing our hands with soap and water at the nurse's station. If your hands become visibly soiled, you need to make sure that you're washing your hands either in the patient room or at the nurse's station after you visit a patient's room, okay? If you have dirt or grime on your hands, make sure you wash it off. Otherwise, just sanitize in and out of rooms. And kind of a general rule of thumb for me was I go into about 4 or 5 patient rooms, sanitize in and out, and then wash my hands at the nurse's station in between about 5. So, and then of course, in between, if my hands get anything on them, they're being washed earlier in between. So Just as a general rule of thumb, when your hands are visibly soiled, you're washing them. Okay, then we're going to position the patient and apply the tourniquet. Support the arm or hand that is to be the site of venipuncture. Generally, an inpatient, your patient is lying in a bed, so it's already supported. If it's an outpatient venipuncture, you have something like a phlebotomy chair where they come in and, they have the arm that swings down and then their arm is supported. So support the arm or hand that is to be the site of venipuncture. If a patient informs you that they get woozy or are prone to fainting when they get their blood drawn, have them lie down on a reclining chair or a bed or a gurney or something to take their blood. Tourniquet application. We're applying the tourniquet snugly 3 to 4 inches above the intended site. If we're poking the AC, that's going to be right up here about mid-bicep. Never apply over open sores. Look for these on older people, so geriatric patients. They have thin skin, they're more susceptible to open sores. And they'll also maybe ask you if you can apply it over their gown or use a washcloth, then you're welcome to do those things. Apply over a gown, shirt, or washcloth if patient has sensitive skin. Make sure you leave a quick release tab. So we'll practice this during skills week, but we'll practice tying tourniquets with a quick release tab so you can just pop that tourniquet right off of there. When you're finished, pay attention to your tourniquet tails. They could contaminate your cleaned puncture area or venipuncture area. So when you're tying a tourniquet, just make sure, if you have a tourniquet like this, make sure the ends aren't dangling down in front of where your venipuncture site is, okay, because they just get in the way. And then once you've cleaned, if the tourniquet tails touch the cleaned area, you just have to re-clean it again. It's contaminated then. All right, after we've applied our tourniquet, we're selecting our vein. The preferred site, just remember, our first preferred site is the antecubital fossa, the AC. First choices are the median, cubital, and median veins. Palpate the patient's arm with the index finger of your non-dominant hand. I'm a right-handed person, so I palpate generally with my left hand. It's really important to get used to palpating with your left hand because you're using your dominant hand to poke. If you miss, okay, you can repalpate and adjust. We'll talk about this. Not fishing like this, okay? Adjust using calculated movements, but you have to be able to feel. So you need to get practice in your non-dominant hand palpating and feeling for the veins. You can also palpate like with your dominant hand before you do the poke. But generally it's just best practice to palpate with your non-dominant. And also, we're never using our thumbs to palpate like this. We always want to use our pointer finger or our middle finger to palpate. They just have better dexterity. You can roll your fingers side to side while pressing against the vein to judge the size and direction. Avoid veins that feel hard and cord-like or lack resilience. So we want a nice kind of bouncy texture. We want to be able to, it gives us a little bit of pushback. And we'll practice this. I will teach you when you come for skills. Once you have selected the vein you want to use, release your tourniquet. Don't forget, we can only keep the tourniquet on for 1 to 2 minutes. Generally about that 1 minute is when we want to find the vein in, or is how much time we want to use to find a vein. Once we have found the vein, we'll pop the tourniquet off as we gather our supplies. We're gathering and prepping our equipment, okay? Gather the appropriate equipment for the vein you selected. Assemble needle sets, place the equipment, including gauze, alcohol swabs, tubes, extra syringes within reach. So you found the vein, you gather the equipment that is suitable for the vein that you chose, put all of your equipment together and bring it back next to the patient, set it where it needs to be, where it's in reach, okay? Prepare your tape. Double check you have everything you need before you proceed. I always go through and I double check everything I've brought. So I look and I say, okay, I have gauze, I have alcohol, I have tape, I have my needle set, I have my tubes. Okay, so prepare everything you need, get it set up in front of you for easy access, and then you can continue. Once you've set everything up, you've double checked everything, you can then reapply your tourniquet. Okay? We want to kind of eliminate hesitation during this stage. Once the tourniquet is back on the patient, we're repalpating the vein that we chose to make sure that we know where it is. If we need to, we're marking it, okay? And we'll learn this in Skills Week. If we need to, we're marking where it's at. Then we're going to clean the site with an antiseptic, and we want this process to be pretty quick just because we have that tourniquet on, so we have 1 to 2 minutes to get it done. We can't leave it on for a long time. Clean the site with antiseptic to combat infection or contamination. Use 70% isopropyl alcohol. That is an alcohol swab or an alcohol pad. This is why we ask if the patient is allergic, because we're using alcohol swabs. Clean an area about 2 to 3 inches in diameter using aseptic technique, which is starting in the center and working our way out in a small spiral. Allow the area to dry for 30 seconds to 1 minute. We're just observing it. You'll see a sheen on the arm where it's wet. Alcohol evaporates fairly quickly, okay? Keep an eye on it. Once it's dry, you can move forward with your venipuncture. So as it's drying, we do not want to wipe away, so we don't want to clean it and then wipe it with gauze to dry it faster. We don't want to fan the site like this, and we don't want to blow on it or allow the patient to blow it. If the patient touches it, then we have to re-clean. So make sure that you're not touching it, you're not fanning it or blowing on it to dry it faster. And patients do sometimes like to touch. So once you've cleaned it, just make sure you tell the patient, okay, don't touch, or we'll have to clean it again. Okay, so just do not touch the site once it's clean. Leaving an alcohol pad pointing in the direction of the vein can be a marker if needed for the site of the vein. So if you can't really see it very well, you can place the the alcohol swab with the corner pointed towards your venipuncture site. That's a helpful tip for identification. There are more that we'll learn when you come. As it's drying, you want to uncap and inspect your needle. You're looking for a nice, straight, pretty needle, okay, with no little fuzzy hairs or metal shavings or bent tips or barbs, anything like that. It's rare, but it can happen. There's a little picture on here that kind of depicts what that might look like. Okay, it's very obvious. You'll be able to see. So you take the cap off, hold the needle up in the light, look at it, make sure everything looks good. And if everything looks good, once your arm is dry, you can proceed with venipuncture. You've checked your needle. Now you're going to anchor the vein, and this just means hold it in place. Sometimes they can be a little wiggly. We'll learn how to anchor correctly when you come. Use your non-dominant hand to anchor or secure the vein in place. Place the thumb at least 1 to 2 inches below the site. Pull the skin toward yourself in the direction of the vein. When we practice this, we're going to be lining ourselves up directly in line with the vein, pulling traction toward ourselves, and then puncturing the arm. We're not going to use the C anchor. This is taught in some places. I don't like it, okay, because it gives you more of a chance to poke yourself in the finger, okay? Some people teach it. I don't. I'm going to teach you not to do it. I like anchoring downward only because there really is no need to anchor above and below if you're doing it correctly. Hold the collection device or butterfly needle in your dominant hand with the bevel facing up or toward you. Place your hand on the patient's arm to establish a firm base. Keep the needle angled upward. Lower the needle angle and position your needle above the insertion site in line with the vein. Insert at a 30-degree angle or less in a smooth, steady forward motion. All right? So as we practice this when you come for skills, I will help you with this process. You are going to anchor the vein down, get a nice solid base, position your needle, okay, at the angle and in place where you want it. And before you poke, you're going to give a deep breath. And then you're going to go in a nice steady forward motion for a nice smooth venipuncture. We don't want hesitancy, okay? We don't want an accidental puncture and then a back out and then a puncture. We want one nice smooth motion, okay, puncture into the arm. That way, it's less stressful for you. It's less stressful for the patient. We don't contaminate the needle and repoke using the same needle. Okay, there are lots of components to this, which you'll get to practice and we'll work on. Anchor the vein. This is an example of anchoring. We're going to hold underneath the back of the elbow and pull down towards ourselves. Insert the needle. Okay, you can see the anchor happening here. You can see under here the fingers resting on the arm for the nice base. We're holding a nice firm grip on our needle set. Okay, and we've entered into the vein that we've chosen. Once we've punctured the patient, we're going to establish blood flow, fill and mix the tubes in the order of draw, and release the tourniquet. We're pushing the tubes onto the needle set with the thumb while the index and middle fingers straddle and grasp flanges of the tube holder. I'll show you all of this. Advance each collection tube into the tube holder until the stopper is completely punctured by the needle. Blood will begin to flow into the tube. The tubes are vacuum sealed. The blood will flow automatically into them. To change tubes, maintain your solid base on the patient's arm to ensure that you are not moving the needle back and forth. With your free hand, always your non-dominant, you're going to gently pull back on the tube while applying slight pressure with your thumb to the tube holder. Then you're going to continue placing tubes and taking them off, placing tubes and taking them off until you have collected all of the samples that you need. Once you pop the last tube on, pop the tourniquet off, let the tube continue to fill, pop the tube off, and then we can move forward. Oh, we'll just back up a little bit. So, collect all of the tubes that you need for all of the tests that you need. On the last tube, we're going to pop the tourniquet off and let the tube fill while the tourniquet is off before we end the venipuncture. We're removing and mixing the tubes in the order of draw. Okay, this is our order of draw. We're starting with any sterile tubes or blood cultures. Okay, and that's because sterility is at its highest point right after we've cleaned the arm. So, because blood cultures or sterile tubes need to be as sterile as possible, we're collecting those very first. Then comes our light blue. It has a very specific ratio, which we'll talk about. And generally, as a venipuncture is performed, the most blood that you're going to get, or the highest pressure that you're going to get, is at the beginning of the draw. Okay, so we want to make sure the light blue tube is full due to the ratio. So sterile tubes, light blue, red, then gold or tiger top. Any greens, dark greens or light greens. Lavender tubes, pinks, and then grays. Okay, we want to make sure that we are collecting everything in the order of draw, and then we're also wanting to invert the tubes correctly as well. So each tube has a different amount of inversions that it is preferred. Generally, it's anywhere from 3 to 10. So I like to do 8 for each, okay? And one inversion of a tube is upside down and then back. Okay, so that's one. So just making sure that we are removing and mixing tubes in the order of draw and inverting them the correct amount of times. After we have filled the last tube and removed it from our blood collection device, we are going to grab the gauze, hover the gauze over the venipuncture site. You can give a count if you want. Okay, out on 1, 2, 3, pull the needle out, then apply pressure. We don't want to apply pressure while the needle is still in the arm. This can be painful for the patient. So grab your gauze, hover, pull the needle out, place pressure. As soon as the needle comes out, we are going to safety it. And if it's within reach, we're going to put it in the sharp container. If not, you can set it next to you on the counter or the bed or the chair. Just don't forget that you have to sharps it, okay? So discard your collection equipment. After you have discarded and cleaned up discarded the collection equipment, so sharps the needle, cleaned up all your trash, you're going to label the tubes, okay? You'll have printed labels that go on each of the tubes depending on what tests you have. Make sure the labels contain the patient's first and last names, date of birth, ID number, or MRN. Date and time of collection, the phlebotomist's initials. A lot of time, the phlebotomist's initials these days will be electronically on there. It's an electronic signature. There will also be additional information such as if it's a fasting test, and then compare the information on each labeled tube with the patient's wristband and the requisition. So just making sure that you're placing the right labels on the correct tubes from the patient you just drew it from. Once you have labeled the tubes, you're going to go back to the patient and check their arm and make sure the bleeding has stopped or nearly stopped. Then you can bandage the arm using tape or Coban. Always check to ensure the bleeding has stopped before placing this tape or bandage. The patients usually stop bleeding in 2 to 6 minutes. Some medications may prolong the bleeding time. Blood thinners arthritis medication, aspirins, things like that. Never apply a pressure bandage instead of maintaining pressure until the bleeding has stopped fully. If we apply a pressure bandage and the patient is still really actively bleeding, it's not going to do anything. The patient's just going to continue to bleed under that pressure bandage because it's not adequate enough. Also, in an outpatient setting, never dismiss an outpatient until they've stopped bleeding. Steps 16, 17, and 18. They're numbered wrong in this PowerPoint, but steps 16, 17, and 18 are dispose of any additional contaminated materials. This means trash, wrappers, tourniquet. Excuse me. Make sure you're checking to make sure that your tourniquet is taken off. Throw away all of your trash, including needle caps. These are the most common thing left in beds by phlebotomists. Thank the patient, remove your gloves, sanitize your hands, then transport the specimens to the lab within 30 minutes. There is a little bit of a buffer. The lab prefers that the specimens be transported within 30 minutes, but it can be up to 1 hour. If you hit that 1 hour mark, they're going to be calling you asking where the specimen is. So try to get your blood transferred within 30 minutes. That is the basics, okay, of venipuncture procedure, step by step as we go through it. It's going to be more fluid as we practice it, okay? That's just the broken down procedure. Pediatric venipuncture is it's generally the same, but it's a little bit different, okay? Children under the age of 2, draws are performed predominantly in the median cubital vein. So if you have a child, so an infant, or a toddler or an infant, any age 2 and under, you are only looking generally in the AC, okay, median vein. A lot of times little kids, babies and toddlers, infants, will have a nice median vein right in the center that you can poke. Now, the general rule of thumb with these smaller humans, okay, little people, little kids, is that if you see a nice juicy median vein, you're not going to poke where you can see it, right? So you can generally see it, right in the center. You're not going to poke right in the center. You're going to move down because we have less length up top. So you're going to move down and you're going to poke it low and envision ending the needle tip in the center of where you can see it, okay? So general rule of thumb for the littler humans is to poke a little bit lower than you would expect or that you would want to at first. Challenges for pediatric venipuncture in children of this age and this size are increased risk of permanent damage if probed too deep. Just remember they're little, so we need to be mindful of the length of our needle and the angle at which we're poking. They have a smaller blood volume, which increases the risk for anemia if we take too much blood from them. So be mindful of the daily, weekly, monthly maximums based on the child's weight. It's all weight-based. We can take way more blood from an adult than we can from a child. So if there are a lot of blood draws coming through for a specific patient that is pediatric, we need to make sure that we're being mindful of the maximums that we can take every day, every week, and every month. With pediatric venipuncture comes parents, okay, because parents generally stay in the hospital with the littles. So that means the parents will have the ID band. You're coming in and you're introducing yourself to the parents. You're establishing rapport with the parents, okay? Earn their trust by being confident, calm, and caring. If you come in and you are shy or you don't really act like you know what you're doing, they're going to ask you they're going to ask you the uncomfy questions. How long have you been doing this? Do you have lots of experience with kids? They're going to ask you all these things and make the environment really uncomfortable for you. And then, sometimes they might request that someone else come. So just be calm, confident, and caring. Inquire about the child's past experiences with having their blood drawn. Absolutely allow them to stay in the room. Most patients will. If the parent is upset, generally the child will be upset, okay? It's a direct energy. The children feed off the parent's energy. It is likely more than one person will be needed to restrain the child. Toddlers have the parent hold them on their lap, securing their legs and free arm. You can do this in the outpatient or inpatient setting. Sometimes the parents will climb into the bed with the patient, with the infant or child, and help hold them that way. You can have nurses come, but generally what you want when you're performing a venipuncture on an infant or a child is for one phlebotomist or a nurse or someone to hold the wrist of the child and put pressure upward underneath the elbow so that the elbow can't bend. So we want to hold the child's arm in place while the parent is restraining the child's body so that we can control any thrashing or kicking or, the other arm coming over and interfering with what we're doing on the venipuncture side. Once we have everything set in place, you can move forward with the venipuncture as normal. It's going to be the same steps as it would be for an adult, just with a little extra assistance. Geriatric venipuncture is a little bit different because we're keeping in mind that geriatric patients have, decreased elasticity, fragile skin. So skin is very fragile and can tear quite easily. This means with the tourniquet, okay? The tourniquet first, because the tourniquet is our first step. This is where you're going to consider placing the tourniquet over their gown or placing a washcloth and then placing the tourniquet over that. They have sensitive skin. It can tear easily and we can cause injury and bleeding. Then we are avoiding tape, the plastic kind. We're avoiding tape if we can, just because it can be pretty rough on their skin. If you have paper tape, use that instead. Place the tourniquet over thin clothing or cloth. It's most likely that you're going to use a syringe and a butterfly, which is a smaller needle set, instead of a vacutainer set, just because the pressure is too great and it could cause issues, hemolysis, vein rupture, vein collapse, stuff like that. Also, butterfly needles provide a shallower angle. They use shorter draw tubes, or we can use shorter draw tubes. And then what we want to do is hold the skin nice and tight. We want to make sure that our anchor is really firm because veins tend to roll due to decreased muscle tone and elasticity of skin. So in geriatric patients, they have those really wiggly veins and, really loose skin that can get in the way of our needle sets. And then also get in the way of our venipuncture. So the last thing too with geriatric venipuncture is generally it takes them a little bit longer to clot and to stop bleeding. So we're going to hold pressure longer so that it gives them time for the clotting process to happen. So we're holding pressure longer on geriatric patients.